Good evening and thank you for keeping it TV47. You are just in time for Body Garage with I, Sheila Chelangat. And on this episode, still in line with the World Kidney Day, we are focusing on chronic kidney disease. Hi, Dr.
Hello.
And still taking us through it is Dr. Hussein Bagha. Dr. Let's begin with, is it chronic disease or is it chronic kidney failure? Which is which?
The technical term is chronic kidney disease because chronic kidney disease has several stages. So before the kidney fails totally, it undergoes through stage 1 to 5. Before it is termed as end stage or kidney failure in layman's terms.
So Dr. for starters, what is chronic kidney disease?
So if you look at the definition of chronic kidney disease, you need to have either a structural problem or a functional problem of the kidneys that has to be present for at least 3 months with implications for health. So if you look at it, there are two components to it. There's either a structural problem or a functional component to it. So the kidney function, it is normally assessed using a blood test. And what we normally look at is your serum creatinine, which is a chemical that we measure in the blood, and through which we calculate your glomerular filtration rate, or in layman's terms, what percent is your kidney functioning at. And if you look at the structural problems, you can look at is basically if you have, let's say, one kidney, or you have cysts in the kidney, or when you do a kidney biopsy, we get some structural problems within the kidney, or we do a urine test and we find proteins in the urine, which is persistent. So that basically will give you the definition or diagnosis of chronic kidney disease.
And you mentioned that you would need 3 months for the symptoms to manifest that one has chronic kidney disease. Does this mean that the symptoms are vague?
Yes.
And so with that, is it safe to say that the chronic kidney disease is a silent killer?
Chronic kidney disease, unfortunately, we pick it up much later, at later stages, because of the fact that the symptoms are quite vague, as I mentioned in the previous episode. And by the time that the patient is really becoming symptomatic and showing signs of chronic kidney disease, it is a bit late. And as you said, yes, it should be classified as one of the silent killers like hypertension or high blood pressure and diabetes.
Okay, Dr. And how common is the chronic kidney disease?
Chronic kidney disease is quite common. Worldwide, we have a prevalence of 850 million people living with chronic kidney disease. In Kenya, 10% of our population has some form of chronic kidney disease, out of which almost 500,000 require some form of treatment or follow-up, and out of which around 20 to 30,000 require therapy for end-stage kidney disease, which is dialysis or kidney transplant vessels, and they tend to damage your blood vessels. So this tends to reduce the amount of blood flows through your organs, including the kidneys as well. The high levels of blood sugars also tends to cause what is called an inflammatory milieu within the body, which also damages the kidneys. So in a nutshell, that's how the diabetes causes kidney disease. High blood pressure, and I always give this example to all my patients, assuming that you have a pump that is pumping water through a pipe at very high force. So the inner lining of the pipe gets damaged over time. And what happens is it becomes thinner and thinner. And that damage to the pipe, to the inner lining, it's the same situation that also happens within the kidney itself as well. So the very small blood vessels within the kidney tend to get damaged. And subsequently, it gets blocked as well, and it leads to scarring within the kidney because of lack of blood supply. So that's the way how both high blood pressure or hypertension and diabetes causes chronic kidney disease.
The chronic kidney disease is all about the kidney. Could you mention to us some of the functions of the kidney?
Yes, so if you have a family history of chronic kidney disease, because some of the things that cause chronic kidney disease are genetic, like polycystic kidney disease, then you are at a higher risk of developing chronic kidney disease. So, and that's why the family history becomes very important.
And can my family history increase the risk of me getting chronic kidney disease?
Well, initially it was thought to be of the older people, but now we know that it can cut across the ages. So there's another cause of kidney disease, which I've not mentioned, is called glomerulonephritis, which is an inflammation within the kidney itself. Anybody can get it, from the very young to the elderly. And a lot of times, as I mentioned, because there are no symptoms, people can be walking around with it, and by the time it is picked up, it is a bit too late. So they already have chronic kidney disease. Of course, the elderly, because of, especially males, because of the issues with the prostate and prostate enlargement, and if it's not picked up, the prostate enlargement causes obstruction, and this can cause chronic kidney disease. Patients with diabetes and high blood pressure, especially type 1 diabetics, we know that type 1 diabetes is a disease of the younger people. If it's not well controlled, can contribute to kidney disease. So as I said, it cuts across the age groups. Yeah, it's not that it's only the elderly or the very young or the middle-aged. It basically is across the age groups.
Well, you mentioned that sometimes the symptoms are vague. Could you perhaps tell us some of the symptoms that manifest before you make the diagnosis?
Commonly, you'll feel very tired because of the toxins building up. You lose your appetite. You have a lot of nausea because of the increased acidity that develops as well. Some people also start having a lot of vomiting as well. The legs tend to get swollen. Your urine output tends to reduce as well. And then you get difficulty in breathing as it now progresses to the advanced stages, because the water tends to build up in the body, especially in the lungs.
You said that it's from stage 1 to 5. So for each stage, Dr. could you tell us what it looks like in terms of the kidney function?
So normally there are 5 stages. So there's stage 1 to stage 5. Stage 5, of course, is end-stage kidney disease, whereby now you do require treatment, especially at the dialysis or a kidney transplant.
I heard you mention the glomerular filtration rate. What is it and what does it mean?
So again, as I mentioned in the previous episodes, we do have medications right now that help to reduce the progression of chronic kidney disease. So we do start the patients on those medications if they qualify for those medications. We have to treat the complications of the chronic kidney disease. Remember, the kidney is very important in terms of regulating your electrolytes, your calcium, magnesium, phosphates, potassiums. It is important in maintaining your blood levels as well and maintaining your acid levels as well. So as a kidney disease progresses, all of those tend to get deranged, and we have to correct all of those. And then, of course, we have to treat the cause of the chronic kidney disease. So if it's diabetes, we have to control the blood sugars. If it's high blood pressure, we have to control the blood pressures. And all of that help to reduce the progression of chronic kidney disease.
You said that it's from stage 1 to 5. So for each stage, Dr. could you tell us what it looks like in terms of the kidney function?
So of course, as I mentioned earlier, that when you look at the definition of chronic kidney disease, you're looking at the structure and function of the chronic kidney disease. So if you look at the stages of chronic kidney disease, we're basically looking at both the structure and the function. So when you're so structurally, I mean, you can look at so there are 2 things we look at. One is your estimated glomerular filtration rate, which we calculate using the chemical called creatinine in the body. So this was primarily what was used. So as your glomerular filtration rate or your percentage of kidney function declines, it means that your stage is worse. But now we're also looking at proteins in the urine, which is now been added recently in the past 15 years, that we need to look at proteins together with the percentage or the glomerular filtration rate. Yeah.
I heard you mention the glomerular filtration rate. What is it and what does it mean?
So it basically tells you how well your kidney is functioning in terms of its processes of filtering. So we use the chemical called creatinine, and we have formula which we use now to calculate it. So if your level of creatinine in the blood is very high, it means that your kidney is not filtering that out.
Yes.
So we use it as a surrogate, and that tells us at what level your kidney is at. Yeah.
So there's some mathematics
Yes.
involved in it.
Yes, it is. And I mean, it's not so complex, and there are formulas that are available online which anybody can access, and they're all for free.
You said that it's from stage 1 to 5. So for each stage, Daktari, could you tell us what it looks like in terms of the kidney function?
Yeah, so as I mentioned earlier that we do now have medications that have been shown to positively slow down the progression of the kidney disease. That is one. Number two, of course, you have to look at the causes. As I mentioned, diabetes and high blood pressure is the most common cause. So by controlling your blood sugars and by controlling your blood pressures, you can slow down the progression. Correcting all the complications, your electrolyte complications, your acid-base complications, you can slow down the progression of kidney disease. Eating healthy. Diet is very, very important when it comes to slowing down the progression of chronic kidney disease. Exercise, another very important thing as well. Very important. Avoiding over-the-counter medications. Some people have chronic kidney disease, yet they go to a pharmacy and buy painkillers over the counter. You are worsening your kidney disease by doing that. Please don't take any medications without your doctor's orders if you have chronic kidney disease. Don't take any herbal medicines as well. Herbal medicines also cause chronic kidney disease. They cause kidney injury, which can become chronic if it's not treated. So once when you develop chronic kidney disease, it's normally not reversible. It's rarely reversible. So the main aim now is to slow down the progression to end stage, which is why we always want to advocate to protect our kidneys, to prevent somebody from developing chronic kidney disease.
All right, Daktari, and with that, we are up for our first commercial break. When we will be back, we'll get to hear from him some of the treatment options available. Do not go too far, keep it TV47, but first, take a look at some of the myths and facts of the day.
You will know if you have kidney disease. Unfortunately, most people who have kidney disease do not know it because in the early stages of kidney disease, most people do not have any symptoms. Symptoms may not appear until kidney disease is in the advanced stages. Testing for kidney disease is a long and costly process. Testing for kidney disease is easy. It can be done during a routine visit to your healthcare provider. Testing for kidney disease is easy. It can be done during a routine visit to your healthcare provider. It can be tested by a urine test to check for protein in your urine. Having some amount of protein in your urine can be a sign of kidney disease. A blood test can also be done to estimate the glomerular filtration rate. If you are at risk for kidney disease, there is nothing you can do about it. Not everyone who is at risk will get kidney disease. You can help protect your kidneys. Eat healthy, get regular exercise, control blood pressure and blood sugar, keep a healthy weight, quit smoking, and don't overuse pain medications.
All right, welcome back and thank you for keeping it TV47. This is Body Garage, where on this episode we are focusing on chronic kidney disease, and taking me through it is Dr. Hussein Bagha. Daktari, before the break, you had gone through the stages. By the time someone now gets to stage 5, does it mean now they have complete kidney failure?
So stage 5 is classified as end-stage kidney disease, or in layman's terms it is kidney failure. And that is a point at which now we start talking to patients about now the therapies that are now available, which is either dialysis or a kidney transplant. Yeah.
For this stage in particular, the kidney functions are completely null.
So by the time you're reaching end-stage kidney disease or stage 5 kidney disease, it would mean that your GFR, or the percentage at which your kidney is functioning in layman's terms, is less than 15. So it means that a lot of the functions of the kidneys are not being performed. So like your regulation of your fluid status in the body, removal of excess water, removal of the toxins, regulation of your electrolytes, regulation of your acid base in the body, your blood levels, all of that is now being hampered. So all these functions are not being performed by the kidney. In some patients, when they reach this stage, depending on other factors, we do start them on dialysis. In some patients, we do have some time where we can talk to them about getting a preemptive kidney transplant, meaning that you don't go undergo dialysis but go straight for a kidney transplant. Or we wait until the percentage of the kidney falls to less than 10. In some patients, we do have the leeway of waiting for that before we start the dialysis.
For the end stage, it's until, you know, the percentage of the kidney function is less than 15 or 10 for others.
15,
What
yeah.
is the normal first for someone with healthy kidneys? And then also take us through for the different stages from 1 to 4.
So what happens is, if you, stage 1 is anything more than 90, and then stage 2 is anything between 60 to 89, the percentage, and then so it goes on like this depending on your glomerular filtration rate. So these numbers that we are talking about are basically your glomerular filtration rate. But remember, now we've also included another component, as I mentioned earlier, about the proteins in the urine. So apart from just the stage, whether it's stage 1, 2, 3, 4, or 5, or we also have to include now the proteins in the urine, because if your proteins in the urine are high, it does signify that you are at a risk of developing end-stage kidney disease faster. Yes.
Okay.
So we have to take all of that into account. And of course, if it's less than 15, your GFR, that's stage 5, and then 15 to 29 is stage 4, then 30 to 59 is stage 3, and then 60 to 89 is stage 2, and anything more than 90 is considered to be stage 1.
Okay.
So that's in a nutshell, looking at the figures and everything. But of course, it's a bit more complex than just looking at one value.
To the other.
Yeah, it has to be taken into account,
Uh-huh.
the entire picture.
Okay. And what does the diagnosis now look like? What are some of the tests that are carried out?
So as I mentioned earlier on, the two most common tests that we do is, one is your urine test, which is very easy to do because it tells us whether you have any proteins in the urine, whether you have any blood in the urine. Then the other one is a blood test, whereby we look at a chemical called creatinine, which will then help us to know or calculate your estimated glomerular filtration rate. Yeah.
Let's get to the treatment bit of it. Now, options that are available through the different stages. Let's begin with stage 1. What are the treatment options?
So we don't look at the stages apart from the fact that when you reach stage 5 or end stage, of course, now you have to undergo renal replacement therapy. But as long as you have been diagnosed to have chronic kidney disease, then there are the baseline treatments or strategies that we use, which include, of course, developing a healthy lifestyle, so eating healthy, exercising regularly, avoiding the over-the-counter medications,
Yes.
which I'm going to re-emphasize so many times, so please don't get bored, avoiding herbal medicines. So this cuts across the stages. Okay. Then you have to look at what the cause of the chronic kidney disease is. Is it diabetes? Is it high blood pressure? You have to control your blood pressures. You have to control your blood sugars. That is of utmost importance. So you also have to look at what the cause of the kidney disease was. Like as we had mentioned earlier, that the most common cause is diabetes and high blood pressure. And you have to control your blood pressures. You have to control your blood sugars, because that was what caused the chronic kidney disease. And if your blood sugars are not going to be controlled well, or if your blood pressures are not going to be controlled well, then it is going to cause more damage to the kidney and cause faster progression to end-stage kidney disease. Then as a disease progresses, as the stages worsen, you start getting the complications. Like we mentioned, you start getting anemia, which is whereby your blood levels are low, your potassium levels start going up, your phosphate levels start going up, your acid levels in the blood start going up. So all of that have to be treated. as it happens. And this is why follow-up becomes very important with your nephrologist. Then there are some medications that now have come into the market which basically have been shown to slow down the progression of chronic kidney disease to end stage. But of course that is to be given at the advice of your kidney specialist. Now, if by any unfortunate means you do reach end-stage kidney disease, or it's first diagnosed at the level of end-stage kidney disease, then the treatment options are much more limited, because now you have to start talking about renal replacement therapy, which is either dialysis or a kidney transplant.
Or a kidney transplant. Okay, let's focus on dialysis. What is it and how does it work?
So dialysis is whereby a machine takes over the functioning of a kidney. We call it a surrogate kidney. I think we have a machine behind us, and this is what a dialysis machine basically looks like. You have a catheter which is inserted into one of the blood vessels in the body, and through which the blood comes out of the body and goes through the machine, where it is cleaned, the excess water is removed, the electrolytes are balanced out, the excess acid is also removed from the body, and then it is returned back to the body. So once when you start dialysis, normally for patients who have got end-stage kidney disease, they are on dialysis either twice a week or thrice a week. Yeah.
And how long does a dialysis session take?
So normally a dialysis session lasts for 4 hours. Yeah.
There are two types of dialysis. What could you mention them in depth?
So the one that we do commonly in Kenya is called hemodialysis, whereby we have this machine. Hemo stands for blood, so the blood comes out of the body and it runs through the machine where it is cleaned and then returned back to the body. The other one is called peritoneal dialysis. In peritoneal dialysis, a catheter is put inside the abdomen and some fluid is put inside the abdomen through that catheter, stays for a few hours, and then it's removed. So that fluid helps with the exchange of the electrolytes and removing the excess water by sucking the water out, and then it's subsequently removed. But commonly in Kenya, we do mainly hemodialysis.
Hemodialysis. And at what point, Dr. do you decide that now, dialysis is not working? Perhaps you could get to, a renal kidney transplant.
So it's not that the dialysis is not working. Dialysis is supposed to be a stopgap measure. So every patient should be offered a kidney transplant. Of course, there are criteria to determine who is transplantable and who is not transplantable. Of course, if you have certain conditions that may preclude you from a transplant, but ideally all patients should be offered a kidney transplant. So once when a patient reaches end-stage kidney disease, the nephrologist or the kidney specialist should start talking to the patient about the different types of renal replacement therapy. The kidney transplant is preferred over dialysis because it makes the patient return back to as normal a life as somebody who has not had kidney disease. They live much longer than somebody who is on dialysis. The complication rates of dialysis are there. They tend to get infections and a lot of other problems which are mitigated once when somebody gets a kidney transplant.
And so for the one that would opt for a kidney transplant, how then selecting the donor, how do they do it? How do you advise for them?
So here in Kenya, we only do the living kidney donation, and we opt for the donor to be a relative. For obvious reasons, because we still don't have the regulations in place to protect the donors. There can be a lot of exploitation, and so that's why the centers, and MP Shah Hospital is one of the centers that does regular kidney transplants. Actually, we just done one today morning. We do prefer that it's supposed to be a relative, and the person who is becoming the potential donor undergoes rigorous tests to make sure that they will not get any kidney disease later on. So that it's not that we are removing the kidney from one person, making the other person healthy, and then later on this person who is donated develops end-stage kidney disease. So they have to undergo rigorous tests to make sure that they will be fit to be kidney donors, and the risk is minimum for them to develop any kidney disease later on in life.
Are there any complications as a result of a kidney transplant?
For the donor or the recipient?
For both the donor and the recipient.
So of course, I mean, it is a surgery. So there are the surgical complications that can happen, but this is why we do this a very thorough workup for both the recipient and the donor. The recipient undergoes a full cardiac evaluation or evaluation for the heart to make sure that they are safe during the procedure, anyone after the procedure as well. Even for the donor as well, we make sure that everything is going to be safe for them during the surgery and even after the surgery as well. Generally, worldwide, the complication rates for the donor are very few. Of course, it has to be done by an expert in an expert hospital, in a transplant center. So that's one of the things that we always have to keep in mind.
So someone can comfortably live on one kidney?
Somebody can comfortably live with one kidney for the rest of their life. The risk of developing kidney failure after donating is very, very low. So it is safe. But of course, safe to the extent that we do a thorough workup for the donor to make sure that they don't get kidney failure later on.
For someone now living after the kidney transplant, are there medications that they're supposed to be on? How is the follow-up care for such a person?
So for the recipient, they need to be on medications to make sure that their body does not reject the kidney.
Okay.
So they have to be on what is called the anti-rejection medications. And these medications they have to be on these medications for life. That's very, very important. And it's important to counsel the patients as well that it's not that it's the end of this thing once when they undergo a successful kidney transplant, then everything stops. No. So medications have to continue for life. They have to be on very regular follow-up with their kidney specialist to make sure that everything is going on well. They have to do regular tests as well. Initially, in the first 1 year, it is more frequent. Then as the years go on, it becomes less and less frequent. And in the third year, once every 3 months. Of course, depending on what caused the kidney failure, if it was diabetes, high blood pressure, you have to control your blood sugars, you have to control your blood pressures, you have to make sure that you avoid the over-the-counter medications again, no herbal medicines, eat healthy, exercise regularly. So all of that still has to be enforced.
Okay, Dr. We are up for a second commercial break. When we will be back, we'll discuss so much more. Is this chronic kidney disease preventable? Do not go too far. Keep it TV 47. Welcome back and thank you for keeping it TV 47. Of course, this is Body Garage, where on this episode we are focusing on chronic kidney disease, and with me is Dr. Hussein Bagha. Dr. Before the break, we discussed how follow-up care for someone who has undergone kidney transplant, and you said that they would have to be on medication sometimes for life. Why would the body reject the kidney that has been donated?
So that is a very good question. The kidney that has been donated is foreign tissue. So the body identifies it as foreign. So it will start fighting it, thinking that it could be something like a bacteria or whatever else it is. So that's why we have to suppress the recipient's immunity for him not to reject that kidney.
That particular kidney. Yeah. Let's take a look at some of the complications connected with chronic kidney disease. Can it increase the risk of cardiovascular diseases? So,
the most common cause of death from chronic kidney disease is not directly related to the kidney, but is from cardiovascular disease. So, more than 50% of our patients pass on or die because of cardiovascular death disease, not because of the kidney itself. And that's very important to understand. Yeah.
Are there other parts of the body that are also affected once someone has chronic kidney disease?
Yes, so your lungs can get affected because of the accumulation of fluids within the lungs. Patients with chronic kidney disease, especially the later stages, and even those who are on dialysis, tend to get a lot of cognitive impairments as well, and it increases the risk of dementia as well. So even the brain tends to get affected, your nerves tend to get affected as well, so they tend to get what is called peripheral neuropathy, so they tend to get numbness or tingling sensation in the hands or feet. So it can affect almost all the organs in the body.
Okay, and when now someone is living with this particular disease, what should they look out for so that it doesn't worsen?
So as I mentioned earlier, you have to look at what caused the kidney disease. If it's diabetes, if it's high blood pressure, you have to control your blood pressures, you have to control your blood sugars. So for me, all patients with chronic kidney disease should have blood pressure machines at home, should have machines to measure their blood sugars at home as well. They need to eat healthy, they need to exercise regularly, they need to go for regular checkups as well. I mean, of course, if they see that a new symptom has developed which was not there, like let's say the legs suddenly start getting swollen or the urine output has suddenly reduced more, then they need to go to the doctor immediately and have it checked out.
Mm-hmm.
So anybody living with chronic kidney disease should always be on the watch out for any symptoms that were not there before developing. So even if they get a lot of nausea, a lot of vomiting, it could suggest that the kidney disease is worsening.
Mm-hmm.
And they need to get it checked out immediately.
Mm-hmm. So
Yeah.
they should always be on the lookout.
Yes.
Okay, you have emphasized the need for, eating a balanced diet. For someone now with chronic kidney disease, are there dietary changes that they have to make? Are there some things that they need to stop doing?
So especially when it comes to stage 3 onwards and stage 4 and stage 5 kidney disease, a lot of the kidney functions start deteriorating. So your electrolytes, especially what we talk about, your potassiums, your phosphates, they tend to start going up in the body. Mm-hmm. And those are not good. Mm-hmm. So you need to, of course, work hand in hand with your nephrologist and your nutritionist to start looking at kidney diets. So we tend to avoid foods that are very rich in potassiums, like avocados, like bananas, even foods that are very high in phosphates, like we talked about in the previous episode about your green leafy vegetables. So we need to leach those. And by leaching, we mean that you soak them in water for at least 1 to 2 hours and then wash the water away, and then you can cook them. But of course, everything is supposed to be in moderation.
In moderation.
Yes.
Okay. Now, when you're managing chronic kidney disease for someone who has diabetes, say they have, been transplanted for, how does it look like?
So if somebody has been transplanted, of course, that's the best thing that can happen. Mm-hmm. And if the kidney is a successful transplant, that's very good. Of course, you have to make sure that your sugars are going to be well controlled. Remember that you're on medications to prevent your body from rejecting the kidney. So that can cause problems. Mm-hmm. With your sugars, because your sugars tend to go up because of the steroids that we use and also because of the other medications that are part of that regimen. So you need to be very closely monitoring your blood sugars and then coming for regular checkups as well. And then of course your diet also is very important as well in terms of helping to control your blood sugars and making sure that your kidney is functioning well.
Mm-hmm. Tell me, why is it that when someone has undergone a kidney transplant, they often tend to lose weight?
So patients who have undergone a kidney transplant, they don't tend to lose weight, but it's just that they become more cautious with their diets. Uh-huh. They are exercising more. Uh-huh. So that's among the reason why they tend to become a bit more cognizant of their weight and their BMIs and try to keep their weight under check. Actually, patients who have undergone a transplant actually tend to gain a bit of weight because of the medications like the steroids. Mm-hmm. Yeah.
Okay, let's move to, how long can someone now live after a kidney transplant?
Well, they can live for a very long time as well. I mean, the longest patient that I'm following up with the kidney transplant was transplanted when I was still a child. Oh. Yes. Mm-hmm. She was transplanted in 1996. Mm-hmm. And she's doing very well. Mm. Yeah.
Okay, that's quite heartwarming.
Almost 29 years now.
Yes.
Yes, on to 30.
Uh-huh. Okay, let's take a look also at preventing now chronic kidney disease. Is it preventable?
Of course, any disease is preventable, especially the chronic diseases. You have to know whether you are at risk or not. As I mentioned earlier, the risk factors are if you have diabetes, if you have high blood pressure, if you have a family history of kidney disease, if you're obese, if you have had acute kidney injury before which recovered fully, you are at a higher risk. Chronic kidney disease is preventable. First, you have to know whether you are at risk of developing chronic kidney disease, whether you have the risk factors for developing chronic kidney disease like diabetes, high blood pressure, if you're obese. if you had a family history of chronic kidney disease, if you have had previous acute kidney injury which recovered fully. So all of those puts you at risk of developing chronic kidney disease. So you need to go for regular checks if you are at risk. Number two, if you have diabetes and high blood pressure, you need to control those. I mean, there's no two ways about it. You need to control your blood pressures, you need to control your blood sugars, you need to go for regular checkups with your doctor as well. Avoid over-the-counter medications, please, I can't overemphasize that. Avoid herbal medicines as well, because those have not been tested and they react differently with different people as well. So that's very important. And of course, keeping yourself well hydrated, another very important thing as well. And then eating healthy and exercising. Yes.
How about smoking, Dr.
So smoking does not directly cause kidney disease, but if somebody has kidney disease, it does increase the risk of progression to end-stage kidney disease. Smoking causes heart problems, and the heart problems will lead to chronic kidney disease. Smoking causes lung problems. Lung problems can also cause kidney problems as well. So smoking is a no-no from all aspects.
From all aspects. And perhaps someone is wondering, does the quality of life get impacted once someone is, diagnosed with chronic kidney disease?
Yes, it does. I mean, as the disease progresses, you tend to lose a lot of strength, you tend to get tired very easily, your blood levels are low, your risk of developing infections becomes higher, you tend to get admitted more frequently as well, and especially in end-stage kidney disease, if you're on dialysis, you have to come a minimum of twice a week or sometimes even thrice a week for the next foreseeable future until you're transplanted. So definitely does affect your quality of life quite a bit. Yeah.
And for someone who is expectant, is there a dialysis option for them? How does that?
So when you have reached end-stage kidney disease, your chances of getting pregnant become much less because your hormones are all affected, but some people still end up getting pregnant. Then for them, dialysis is still an option. Although we have to adjust the dialysis timings, we have to increase the number of hours they are on dialysis, because of course we have to make sure that within the body the milieu is kept as normal as possible for the pregnancy.
And Dr. when we were talking, it's about lifelong medication, and sometimes there's medication fatigue. How then do you advise your patients who are on this, they have chronic kidney disease and they need to be on this medication, but sometimes can be tiring?
It can be tiring, but you see now you can look at it from two aspects. Those who have chronic kidney disease, so you don't want them to progress to end-stage kidney disease. So it's important to talk to your patients, counsel them regularly. We're all human beings, we get tired. Okay? And nobody wants to end up on dialysis. And then there's the other aspect of those patients who have been transplanted.
Yes.
They are also supposed to have medications for the rest of their life. And again, once when they feel better and everything is improving and they're no longer coming to the hospital for the regular dialysis, after 6 months, 12 months, then they feel like, oh, everything is okay. Some people do tend to stop their medication. So again, it is all through rigorous counseling, constantly checking up on your patients, reminding them to take their medications. And it's important to work with your nurses as well. They're very integral in this, your transplant coordinator.
Okay. And for the donor for the kidney transplant, are they also amongst those who would be on lifelong medication?
So the kidney donor is not on any medication. They are basically, they can get back to their normal life after 1 month. And they need to, again, eat healthy, exercise, hydrate themselves well. And even for them, they need to be on regular checkups. Initially every 3 months and then every 6 months. So that's very important. Yeah.
And as we wind up, Dr. perhaps your pro tips for someone who has chronic kidney disease, perhaps your advice to them, and also for someone who has not yet got the chronic kidney disease, what is your advice?
So one thing is that chronic kidney disease is not a life sentence. I mean, when I first came back to Kenya, it was more than 10 years ago when I came back as a qualified nephrologist, and I would tell somebody that you have end-stage kidney disease and require dialysis, and they would break down totally, and they're like, oh, I need to go to see my lawyer and sign a will, and that is not true. Patients have been on dialysis, if you can't get a transplant, for almost 50 years, and they've been living okay. I'm not saying that patients should only be on dialysis. Ideally, transplant is better than that. So there are treatment modalities available for chronic kidney disease, but you have to make sure that it is diagnosed early so that you can prevent the progression. Even if it's diagnosed late, it's not a death sentence. As long as you follow your doctor's instructions, follow the treatment guidelines and the regimen that your doctor has prescribed for you, it is going to be okay. For those who have not developed chronic kidney disease, it is important to keep your kidneys healthy. And one of the ways by doing so is by going for regular checks, especially if you have risk factors for chronic kidney disease, and maintaining a healthy lifestyle.
Maintaining a healthy lifestyle.
Yes.
Thank you very much, Daktari. It was a pleasure having you on the show.
Thank you.
All right, and for you back at home, it's always a pleasure having you in on each and every episode. Thank you for keeping it TV47 and of course Body Garage. Until next time, it's goodbye and good night.